can remember the gonadal vessel, the iliopudid, the right pudid. And what is this?
This is mesentery.
Root of the mesenterium. The root of the mesenterium is passing anterior to the right pudid, right ureter. It was one of the questions for Iranian in this semester. Okay? We ask you a question here about the anterior relation of the right ureter. All of the following structure are passing anterior to the right ureter except one of the answer was the, for example, the gonadal, the iliopudid, the right pudid, and the, for example, the mesocolon sigmoid. Is it correct? No. Mesocolon sigmoid is anterior to the left. The mesenterium is going anterior to the right ureter. And in the left side, look at the ureter, the gonadal, the left pudid. You can remember the sum of the ovary, for example, the sigmoid branch, and the root of the mesocolon sigmoid, they are going anterior to the ureter. Now you know that how to find the position of the both ureter in your patient. In this picture, if you connect a apex of the lumbar transverse process, if you connect the apex of these lumbar transverse process to each other, you can find the position of or the path of the ureter. Okay? In the surface anatomy, if you want to draw the way, the path of the ureter, you can connect the apex of the transverse process of the lumbar vertebra to each other. They are going to remember you the position of the ureter, left and right ureter. And according to this picture, remember that both kidney and the flaps are going to be found inside of the pelvic cavity. Tomorrow we are going to speak about the embryology of the urinary system. In embryonic period of the urinary system, I'm going to explain for you three structures. One of them is going to be appear in the cervical region of the fetus or the embryo. One of them is going to be appear in the thoracoabdominal, and one of them is going to be appear in the pelvic region. The cervical area and the thoracoabdominal area disappear, but in the pelvic region, the kidney, both kidney are going to be formed and develop inside of the pelvic cavity. When they are going to appear inside of the pelvic cavity, the both umbilicus are going to look for directed anterior. Okay? But during the development of the urinary system, both kidney in the pelvic cavity are going to appear and they are going to ascend. When they are going to ascend to reach to the anatomical position, they are going to rotate. So inside of the pelvic cavity, both kidney, the umbilicus is going to look anterior. When they are ascend, they rotate. And normally, in both sides, left and right kidney, the umbilicus rotate medially. Now you imagine, one of them ascend and one of them remain inside of the pelvic cavity. It is a congenital process. It is possible both of them come up, and they ascend and rotate laterally instead of the medially. One of them rotate medially and one of them rotate laterally. All of them are going to remember you to be able to imagine that how many congenital diseases it is possible to appear for the both kidney. Both of them, it is possible when they are going to appear inside of the pelvic cavity, join to each other, fuse to each other completely or in a small segment. You should know. So at the first, both kidney appear normally in the pelvic cavity. And in the pelvic cavity, the both umbilicus directed abdominal aorta. Example, it is possible arise from the common area. During the development, both kidney ascend to be able to reach to the normal position. When they are ascending, they are going to rotate medially. When they are ascending, the proximal or the previous artery disappear, degenerate, and a new artery are going to be formed for the both kidney. So when they reach to the normal position, the previous artery degenerate and a new artery are formed from the abdominal aorta. It is a normal position. Now it is possible that these previous arteries remain and never degenerate. So you can find a kidney with multiple arteries. Normally, we have one branch from the abdominal aorta for each kidney. But if during the development, this previous artery never degenerate and remain, this form of the kidney is going to be formed for us. We have a kidney with multiple branch of the artery from the abdominal aorta that they are going to go to supply the, for example, right kidney. This multiple artery can be good, and this multiple artery has advantage and disadvantage. About the advantage, if you have so many branches, it is possible they make anastomos inside of the kidney, and we need to this anastomos. I told you, all of the renal artery are terminal, end artery, and never anastomos. Now, with multiple artery, it is possible you find opportunity, it is possible you find the anastomos between these branches. And this anastomos can be helpful, useful. For example, if this branch is going to get a stenosis, because this area of the kidney is going to have two arteries, so this artery is going to supply here, and never the ischemia and necrosis is going to appear here if you have multiple arteries. But the disadvantage, imagine this extra artery is going to reach inside of the kidney. It is possible this artery compress the pelvis, compress the ureter, and the lumen get narrow. Okay? So the urine is coming and accumulate proximal to this compress, and this urine is coming back to the kidney and making problem for the function of the kidney. So the disadvantage, remember that the extra for this multiple artery is possible when they are going to reach to the kidney, compress the lumen of the ureter, compress the lumen of the pelvis, and making a stenosis in the lumen. So the urine is coming proximal part of the stenosis and accumulate here. About the vein also, it is possible you can find some variation. For example, normally we have one vein for each renal vein, but abnormally it is possible you find two veins, or you find a circular vein. So about the artery and about the vein, it is possible you can find abnormality. Now, in this picture, you are going to look at the horseshoe kidney. What is the horseshoe kidney? In horseshoe kidney, you can find that the superior pole or inferior pole, according to this picture. Here we have the fusion in inferior pole of both kidney. It is possible this fusion happen in the superior pole. We call the horseshoe kidney. Look at the horseshoe kidney or any fusion of both kidney. If you have any fusion of both kidney, you should know that these both kidney always remain inferior. Never be able to get to the normal position, because you can hear this artery we call the inferior mesenteric artery. This artery is going to But if you find this picture cake form or this form, then you can find this form of the kidney inside of the pelvic cavity. And look at the umbilicus, because both kidneys remain inside of the pelvic cavity, they never can rotate. Here, this is a schematic picture. They are going to remember you that only congenital form of the kidney, it is possible to appear. What's the name of this form?
Horseshoe.
What's the name of this form?
Pelvic.
Cage or disc form. What's the name of this form? Sigmoid form. S form. Look at here. The inferior pole of the right kidney is going to fuse the superior pole of the left kidney. And look at the position. All of them remain inferior. Here, it is possible. Both kidneys go to the one side, left side or right side and fuse to each other. Please pay attention to the direction of the ureter. These ureter are going to get and reach to the urinary bladder, but here we have some problem. What is this?
One kidney only has ascended and the other remained in the pelvic cavity and does not rotate.
Yes, so we can call the pubic kidney. It is ectopic kidney. Ectopic means
Out of place.
yes, about the abnormality about the place in the pelvic, during the ascending scar, or sometimes in the left side you can find a defect in the diaphragm. So the left kidney, it is possible pass through the defect of the diaphragm and go inside of the thorax cavity. You take a radiography and you find a tumor inside of the thorax cavity, and you can find it is ectopic, thoracic kidney. So some of the ectopic is going to be found inside of the pelvic cavity, and in the left side it is possible the left kidney used, and we have a defect in the phrenic muscle, in the diaphragm muscle, and this left kidney go from this defect and reach inside of the thoracic cavity.
How do we differentiate between tumor and ectopic kidney through the radiography?
No, the radiography, yes, you can find. There is not only radiography, you are going to do some tests, okay?
That's
so
right.
with all of them, you are going to find that what is this mass inside of the thorax. It is a urinary, it is a brain, or it is something such as a tube. Now here, if you notice, you can find and look at to the cyst. We covered this form of the cyst, the multicystic. Multicystic is going to show you this picture. This is such as the grape. The cysts, some of them are very large, some of them are very small. They are going to connect each other by the loose connective tissue. And inside of the abdomen cavity, it is such as the mass of the grape. The baby is coming out with a mass inside of the abdomen. It is a congenital disease, but it is not, the reason is not the gene. During the development of the urinary system, something happened, and the development of the urinary system is not going in the normal way. Not gene. For example, it is possible something happened during the pregnancy for the mother. For example, losing some of the blood or something else. Something happened during the pregnancy. So the development of the urinary system is not going to go in the normal way, and it is going to make the cyst. It is not gene. The reason is not gene, because the multicystic. And you should know that in multicystic kidney, you should know, in multicystic kidney, we have some cysts. They are going to connect with the loose connective tissue. And you should know that with the age, 1, 2, 3 cysts are going to appear inside of the kidney. If everybody normal with the aging and nothing happening. But this form of the kidney is going to stop the function and making problem. And another form of the cyst are visible in this picture. We call the polycystic. Kidney. In polycystic kidney, tomorrow we are going to tell you that we have two kinds of the polycystic kidney. One of them is going to appear during when the baby is coming out. Very soon, you are going to find polycystic kidney exactly after the delivery, during the childhood. And one of them is going to appear after the 40 years. One of them is going to appear in adult after the 40 years. And one kind of the polycystic are going to be appear during the childhood. We have two kinds of the polycystic, and the reason is gene.
Dominant and recessive.
Yes. We have the dominant and the recessive. Tomorrow I'm going to show you some picture. But about this picture, I explain for you. What do you think about this picture? This picture is going to remember, it will explain for you which item.
I think it should explain the position of the ureter in relation with the artery, with the abdominal artery,
Yes.
with the renal artery, and common
Yes.
area.
I told you the ureter is very long. It is around 25 to 30 to 40 centimeters. The first part is passing through the abdomen, and in the continued is going to enter to the pelvic region. In the distal end, it is going to pass through the fundus or posterior surface of the urinary bladder to be able to reach inside of the urinary bladder. Superiorly, the ureter is going to supply by some of the branch that arise from the renal artery. In the midway, some branch from the gonadal artery, some branch from the common ileum, and in the inside of the pelvic cavity, internal ileum also are going to supply the ureter. Now, about this picture, the sympathetic and parasympathetic are responsible in the urine or kidney. They are responsible in the both ureter. And here, about the lymphatic node, you should know the lymph of the both kidney are going to drain inside of the lumbar lymphatic node. They are going to drain the lumbar lymphatic node. Here, which kidney is visible here?
Left. Right.
Left is here. Left has relation with the spleen. Right has relation with the liver. So please remember this relation. Look at this picture. Right kidney, left kidney. Left kidney is near the spleen. Right kidney is near the liver. Now, if I come down, and according to this picture, you are going to look at the tumor in the right kidney, and we know right kidney has relation with the liver. So this tumor or this cancerous cell is possible making problem for the liver. And according to this picture, if you look at here, the right kidney has tumor, and we know the right kidney has relation with the second part of the organ. So this relation is going to affect in the second part of the organ. What is this picture going to show to you?
Pelvis.
Pelvis what?
Pelvic inlet. This is, I think, the bladder.
To the bladder?
Yes, and that's the ureter. You see
ureter.
the right
Right
side.
here is not visible, but here it is going to show you the ureter. What happened here? Why the ureter dilated?
Some of the stars.
Yes, yes.
Yeah.
I told you the narrowest part of the lumen is inferior part of the ureter when it is going to reach or pass through the urinary bladder. It is possible a stone come here, so the urine is coming and accumulate proximal to this narrowing part. Okay? But in the left side, nothing happens, and it is normal.
And the kidney also is full of urine.
Yes,
and
because this urine is going to come back to the urine. Hydronephrosis is going to happen.
That's fantastic.
So please be careful about the relation. Relation, yes, it is easy. I draw for you a quadrangular picture and told you about the anterior relation, posterior relation. What is relation? It is possible making problem for the patient. Now look at this picture. According to this picture, it is female or male sex?
Female.
Female. In this surgical section of the female pelvic cavity, we are able to show you the urinary bladder, the anterior organ. And the posterior organ is the rectum, and in continue the anal canal. Between the rectum and urinary bladder, in the female pelvic area, we can find the uterus and vagina. The uterus is going to rest the superior surface of the urinary bladder. Then both of them are empty. Means the urinary bladder and the uterus are the pelvic organ. Normally, they are going to be found inside of the true pelvic cavity or a small pelvic cavity. But when the urinary bladder is going to dilate it with the urine, it is coming up. It is possible to go inside of the abdomen. Now when it is empty and the uterus is empty, both of them are going to be found inside of the true pelvic cavity. And always between the uterus and vagina, you can find the angle. This angle is normal and useful. If you